Good evening, everyone. I'd like to call to order the Community Mental Health Full Board meeting for July 27th, 2022. We'll start by saying the Pledge of Allegiance. Please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next is going to be Ryan with the reading of the mission statement.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is an adoption of the agenda. I'll take a motion to adopt.
So moved.
Motion from Dana, support from Lori. Questions, comments on the agenda? Seeing none, all in favor signify by saying aye. 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 All opposed? The agenda is adopted. Next, we will move on to hearing of the public. Anybody from the public wishing to speak, you have 3 minutes. Give us your name and address. Hit the little button at the base of the microphone to turn it on. Go ahead.
Hi, my name is Nancy Worthman, and I'm the director at Liberties, Inc. on North Avenue in Gratiot. And I'm here to give an update. Our balance in our checking account as of July 1st was $23,432.47. Our savings account was $3,600 and a nickel. That includes a deposit for $1,800 from St. Michael's Church. That was in June. And then we just got a small deposit also to put in our savings account from, I don't know who it was just a nice donation of $50 for, they just wanted to help Liberties out, and I thought that was really sweet. So we sent them a thank you, of course. Co-America, our bank, we normally bank at Martin and Gratiot. They're moving, they're closing that branch, so we will start banking at 10 Mile and Kelly. I met somebody from Henry Ford Health when I was at the Dodge Park Thursday night. They have concerts, and I was there for the farmer's market, and I spoke with her. She's a registered dietitian, and she is thinking that, or not thinking, but she's going to try to help Liberties out with nutrition. So I'm talking with her about that. I also met the director of I didn't meet her, I spoke with her on the phone, the director of communications for Macomb County, Kathleen Okray. She is willing to do something with Liberties when it comes to the Clinton Macomb Library and adult programs, so I'm really happy about that. We're in the final stages of our newsletter. We're finally going to have a newsletter starting in August. I'm hoping in August, if not September for sure. It's a nice newsletter. I'm really happy with it, and I hope all of you are too. Haircuts started back at both locations. There for a while we didn't have someone to do haircuts, and now we do. The community garden, that's coming along great, and we've got members that have been participating in it, which is nice. Sometimes it's hard to get our individuals to be motivated, and the garden has definitely helped. We had an open house on April 26th. It wasn't a big turnout, but I still felt it went nice. And the people that did show up were happy with it. After that, it seemed like our membership has increased quite a bit. We're on an average of 27 people at both branches, the south and the north, per day. And I mean, it's been a year and a half since I've been doing this, and when I first started, there were only a few members. So that's good news. Cricket Wireless has been there the last week and handed out between 15 and 18 phones to our members, which has been a great help to them. We had an ice cream barbecue social luau. That was in June, and it was a cheap event. We had approximately 50 members, and they loved it. May was Mental Health Month, and we did Painting with a Twist, and we had approximately 12 people participate. Section 8, we had approximately 7 members that we helped with that for just this past couple weeks, 2 weeks ago, for St. Clair Shores. Today, I spoke with somebody that, well, she's got the qualifications and she is very interested in doing something for Liberties, and she would like to help out where it comes to the NA group that I've been wanting to start. So we're finally getting an NA group started once a week. We've got AA once a week. And then last but not least, I just wanted to thank CMH for granting our wish list. I had sent a wish list over to Dave, and I really appreciate it. Thank you so much.
Thank you. Thanks for submitting a list, too.
No problem.
Anybody else from the public wishing to speak? Anybody else? All right. Seeing none, we will close the hearing of the public. There is another one before the end of the meeting. And we will move on to item 5A, approval of the minutes of the CMH full board meeting on June 22nd, 2022. Take a motion to approve.
Motion to approve. Support.
Motion from Lori, support from Selena. Questions, comments on the minutes? Nick, go ahead.
No, I was just going to say I'll abstain as I was not able to attend.
Thanks, Nick. Anybody else? All right. All in favor of approving of the minutes, say aye. Aye. All opposed? Minutes are approved with Nick's abstention. Next, we'll move on to item 6A, approval of the minutes of the CMH Program and Budget Committee meeting on July 13th, 2022. I'll take a motion to approve those minutes.
Move to approve.
Support.
Motion from Linda, support from Ryan. Questions on the minutes? Nick?
Same thing. I missed
Okay.
that meeting, so I'll abstain.
Thanks, Nick. Anyone else? All right. All in favor signify by saying aye. Aye. All opposed? Minutes are approved with Nick's abstention. Next, we'll move on to item 7. All of these items were brought up in program and budget, so I'll entertain a motion to approve.
Motion to approve 7A through 7E.
Thanks, Ryan.
Support.
Motion from Ryan for A through E, support from Dana. Questions, comments on any of these items? Okay. All in favor signify by saying aye. Aye. All opposed? Those are all approved. We'll move on to item 8, receive and file. This is a new item, a request for safe house improvements. I'll take a motion to receive and file that item.
Motion to approve. Support.
Motion from Lori, support from Selena. Turn it over to Dave real quick.
Yeah, we were having the work group for a while to review the provider submissions for special funding request. Again, that was in response to the board's request for us to, work to spend as much of the money as we could appropriately, given the increases we've had in our revenue, with a special focus on one-time funding, because we know that our revenue will be reduced at some future point when the public health emergency ends. So this came in from Safe House after we had been meeting in that board work group. Safe House is a crisis residential facility for our children. They are now providing some outpatient services as well. They are located here in Macomb County. So we had made the generators available to some of our other adult foster care licensing homes. As a child caring institution, they're either a child caring institution or a therapeutic foster care. They were not involved in the AFC approval for that, so we did review the request for that. The other appliances, again, we made those available to all of our licensed facilities on the adult side, but we wrapped back around with Safe House. In addition to that, I think we did review, they're able to do some podcasts specific to mental health, specific to the Ukrainian population, if you recall, Dr. Kologian and his staff were with us when we did the Ukrainian event with Mark Hackle. And let's see, the landscaping, the fence placements and stuff too is specific to the clientele. There's a safety factor that goes along with that. So we did review this internally, went through finance. We do have the funding available to it, and we think it'll go to good use.
Thanks, Dave. Any questions? Dana, go ahead.
I'm gonna hit the button.
Hit the button.
I'm just, I think this is great, first of all, but I'm just wondering, is there any more? Like, are other places submitting things like this, or is this what we have for now?
We have a trickle coming in right now. The providers have all been informed numerous times at this point that we are open and willing to consider creative approaches. We do meet every Wednesday at 1 now with our finance committee. We have a detailed agenda, and we do review these things as they come up. Actually, today, if you in the Macomb Daily, there was an article about the homeless students with the Macomb Intermediate School District, and they were looking to get donations to help out the students. So I sent that internally, and hopefully by Wednesday of next week, we'll be able to consider something like that as well, due to our homeless outreach efforts, our collaborative efforts with the school to see if there's anything we can do. So we're actively and ongoing, and on an ongoing basis, looking for these types of opportunities where we can help the community and our providers. Some are obviously a little bit more creative in their thought process than others. But yeah, we'll entertain any suggestions. Liberty's mentioned their wish list and things like that. We were able to help Bruce out at the Crossroads Clubhouse too. I was out visiting Bruce, and it was just like, you know, we've done some nice upgrades out there, but there's additional technology and some other things that would help the people that attend there. So yeah, we're actively doing it, and I shared our results to date in that email with our spending summary and the special projects and things like that.
Thank you.
Thanks, Dana. And one thing why I kind of wanted this to be, you know, seen at full board is so that all of our providers can see what others are doing, just in case they're not talking with each other. I know our CMH team is spreading the word, but you know, they can see on paper in an agenda item, hey, Safe House is getting these things. Maybe we need, you know, a new fridge or a new fence or something like that. So it just keeps the ideas flowing, and then it also gives us the transparency to see what they're asking for and how much as well. So anyone else with other questions, comments? Okay. All in favor signify by saying aye. 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 All opposed? Motion passes. Next, we'll move on to resolutions. We do not have any today. We'll move on to item 10, which is bill payment. Take a motion to pay the bills.
So moved. Support.
Motion from Megan, support from Linda. Questions, comments on the bills? Okay. All in favor signify by saying aye. 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 All opposed? Bills are paid. Next, we'll move on to our CFO update from Richard.
All right, good evening. Just a few highlights for our May monthly finance report. On page 2 of the report, page 66 of the packet, as we look at our revenue trend, just a couple of highlights for May on revenue. You can kind of see it if you look at it, but we did see a little bit of a bump in the May revenue from prior months. Just a reminder, we've been talking about that for a couple of months. So in May, we did see that increase in our revenue related to that DCW adjustment we've been talking about. So again, for the first 7 months of the year, the state has been funding us at $2 per hour, and they finally bumped that up to the $2.35 that we've been passing through to our providers. So we will see that revenue increase maintained from May through September, and so we will see that increase. On the eligibility, the second graph on that page, also we continue to see a month-over-month trend of increasing eligibility. Just recently, I believe it was last Monday, we got the notification that the federal emergency was extended for another 90 days. So that gets us to the middle of October is when that has been extended to officially. Again, looking at the crystal ball, so to speak, I do expect it might get extended one more time to the beginning of next calendar year. So we'll keep our eye on that. And again, once that federal emergency does end, the state has multiple times told us that they will do a reconsideration process that will be checking people, and that's going to be drawn out over 12 months. So it's not going to be everybody drops right away. It will be a 12-month process to get people corrected on the Medicaid eligibility rules. So if we move on to page 3 of the report, the highlights on the balance sheet are assets. Again, cash and investments is up significantly from the end of last fiscal year, primarily due to the additional revenue that we have at this point in time, and then some of that cash that is due back to the state of Michigan. Same thing on the liability side. So our payables to our vendors are up because we do estimate that we've got claims lag, that claims that services have been provided, but we haven't been billed for yet, so we do estimate what that is. So our liability is up for that reason, and so that will offset some of that cash as those start trickling through as we close the year. Page 4, as we look at the income statement, again, as we get closer to the end of the year, our projections get more and more precise. Our revenue is looking like it's going to be pretty close to what we saw in actual revenue last year. And our expenses are going to be a little bit higher than what we actually saw last year. And again, that's both the provider stability stuff that we're doing, some of the incentives that we've been able to provide. We do expect that those incentives are going to trickle in a lot in the last 3 to 4 months, right? Because we just approved that in the last couple of months. So we do expect that we'll continue to see that spending trend up the last few months of the fiscal year. So in summary on page 5, just kind of where we're at through the month of May. For Medicaid, actual of $157 million received, 103 spent, so about $53 million surplus. Healthy Michigan, $24 million received, about $9.5 million spent, so about $14 million surplus. And on the general fund, about $6.8 million received, $3.9 million spent, so just under $3 million surplus. Fully funded risk reserve, again, is what we're projecting for the end of this fiscal year, and fully funded savings. The only other highlight that I would offer, kind of a verbal highlight, my hope had been to incorporate our CCBHC program into this month's financial statements. Unfortunately, we continue to have back and forth with the state. It's not just Macomb, it's all of the PIHPs and all the CCBHCs that are struggling to say, okay, how do you want us to record and report this revenue and the related expenses to you? So as an update to the board, we do have a meeting that's scheduled with the state of Michigan this Friday. So I will be participating on that, and it's trying to get down to that nitty-gritty. Okay, how are we going to reconcile this? How are we going to report the revenues and the expenses? So from an update perspective, the hope is we'll have answers on Friday, and I'll be able to incorporate those into future financial reports. So any questions or concerns?
Thanks, Richard. Anybody have any questions for Richard? Come on, he drove all the way out here. Thanks, Richard.
Thank you very much.
Appreciate it. And now we will turn it over to Dave for the CEO update.
Good evening, everybody. You probably saw the headlines. The Board of Commissioners did approve the new attorney position specific to CMH. Thank you very much to Phil. I did meet with John Shapka, Corporation Counsel, this morning. That position is being posted for about 2 weeks. He did invite me to be involved in the interview process, so that's moving forward quickly now, and I'll keep everybody posted. I have been attending the directors meeting through the Community Mental Health Association yesterday and today, when I could. And updates from that meeting, so it's the directors forum. The Shirkey and Whiteford information is still out there, kind of circling like sharks and stuff, but we've been successful in holding it off with a lot of praise to the numerous boards of commissioners, the sheriffs who have supported us, along with the on the labor side. It's been very welcome. Their support has been very helpful in that regard as well. There's rumors out there that people are talking to each other, and there seems now to be a focus on children's services and autism services, and maybe trying to carve those out. So they're continuing to actively watch this from the association side. If anybody hears anything, I'm happy to follow up with that as well. It's pretty much now it'll come up into the lame duck session. Will be our next kind of have to wait and see what might come up in that time frame. They are bidding out the Medicaid health plans next year. The risky side there is they could dump almost anything they want into those contracts for next year. So when they issue the RFP, they could include behavioral health, they could include autism or children's services or anything like that, and just kind of bypass the legislative actions and stuff too. We're not hearing anything along those lines, but again, the people are being very watchful at the state level, which is helpful. I did share the spending and accomplishments packet with the board. And again, that was a summary of the various rate changes that we've been able to make this year, thanks to you all. The one-time funding things that we were able to do through those special programs. The provider stability payments were also summarized in there. And like I said, happy to answer any questions. And now I'll make sure any of these new ones that continue to come up come to your attention as well. The 988 is the National Suicide Lifeline number. I corresponded with a number of you when that came up. It went active nationally on July 16th, and our own Crystal Buizy, who's our Director of Community Behavioral Health Services, was featured on WDIV. They contacted us, they contacted her about 4 minutes to 5 on that Friday, and she was able to set up the Zoom interview from her home. She contacted me, of course. I happened to be in the car. I couldn't make it. But lots of total faith in Crystal's ability to represent us, and of course that went really well. Workforce shortages continue to be the crisis, primary crisis. That was a point of discussion at today's directors conference. There will be a meeting in August now with folks from the department. They've had listening sessions. They've been gathering information. Not quite sure what to expect from this. Apparently there was a delay. Well, there was a delay, but part of that delay was became a possible connection to a larger issue statewide, but now they've carved off to themselves. So I'll keep everybody posted on that. But we have been vocal here. I have participated in those work group meetings with folks from the department. and bringing forward any recommendations from our specific area. We met this morning. As I said, we meet on Wednesdays with finance. We did issue the recruitment and retention memo out to our providers. There was about 8 pages of questions that came up. I finished my review of all of those last week. We went back through them today as a group and settled on our response. And with Christina's help from Network Operations, we will be setting a meeting where the providers can log in, hear answers, ask additional questions, and we will be we're very close now after today's meeting, having a frequently asked questions document that'll go out to the providers as well. Throughout all of this, we did notice the folks who are self-directing their services. When we increased the community living support and respite rates, those impacted people under the self-determined arrangements a little bit differently. So we are meeting with the fiscal intermediaries and some of the case management providers who are supporting people under those arrangements, again, to share information specific to those types of arrangements and to answer any of their questions too. So, and then lesson learned going forward, when we have these types of changes, we will make sure we address those issues right up front. Going back to some of the budget updates, the fiscal year 23 final budget does include a little over $100 million statewide for CCBHCs. The opioid settlement fund of $23.2 million statewide. I do have a meeting at the county Monday specific to the opioid funds that are coming into Macomb County. And Helen Klingert is working closely with me on that, thankfully. The MyCal, the Michigan Crisis and Access Line, $3 million, and that includes the Suicide Prevention 988 Lifeline. And $10 million for jail diversion, which I need to do a little digging on because we are looking at jail diversion programs for Macomb. And I think those were the highlights for this evening. Happy to answer any questions.
Thanks, Dave.
Thank you.
Questions? Comments? Nothing? Quiet? Okay. Thanks, Dave. With that, we'll move on to other possible agenda items. Couple reminders. Program and budget for August will be August 10th here at 6 p.m. and full board will be August 24th here at 6 p.m. Are there any board members with anything they'd like to mention, bring up, talk about? No? Okay. We'll move on to the last hearing of the public.
Good evening, everybody. My name is Sean. I'm with CEO, just to give the monthly report. At our Anchorville location, they made flower pots with the person served, along with tie-dye face mask and wind chimes. They also held an ice cream social for everyone as well. They are hosting a bottle drive fundraiser as well. A flyer for that is attached to the back of my report. At our Mount Clemens, Clinton Township location, they are acquiring tickets for the Armada Fair and renewing their passes to the Henry Ford Museum. They're also obtaining new furniture and games for outside. At Washington, they delivered over 240 Meals on Wheels. They added a new sun umbrella to the picnic area. 11 tall trees were removed from around the property line. Their fire alarm system was upgraded. New activities, outdoor games, and new fishing poles were purchased for the person served. One of their classrooms was also updated and redecorated as well. And then also, just to reiterate, at Anchorville, they're hosting a bottle drive fundraiser. They will also pick up bottles from any location if need be as well. All the information's on the flyer, and that's going on till the end of September. And then lastly, at our, And our summer camp went over great with the person served. It was held at Brandenburg Park in Chesterfield throughout its duration. We received positive feedback from the person served telling us how fun it was. Some of the activities they did was painting, planting flowers, the water pads, swimming, feeding fish, fishing, and much more. We're looking forward to having this again next year in the summer of '23. Person served are looking forward to having karaoke, a campfire, and more days of camp for next year. And then just lastly, too, I just brought a little example of what they were doing. But for like their painting class, they had, they had like a little color key card to follow along, and then this is some of the rocks they painted, how they turned out. So, and then just in the rest here was just DNR fishing related things and whatnot. So, but everybody had a good time. So, thank you.
Thanks, Sean. Anyone else from the public?
Bruce Dutton, the director of Crossroads Clubhouse. Just wanted to provide a little bit of a update. I think in May, I came to the board and asked for permission to kind of go out of state for some colleague training. We worked crazy trying to get everything to coordinate and line up so that people could go, and it just didn't work out for us. Either colleague training bases were canceling their colleague training for COVID purposes or whatever the case may be. So in order to be transparent, I just wanted to come back and let everybody know that we weren't able to do that this year. I did report that to the Michigan Department of Health and Human Services, and they told us to reapply for next year's grant, and we'll make that a priority to do that early in the fiscal year so that we don't miss out on that opportunity. However, with that being said, the Clubhouse International World Seminar is in September in Baltimore, Maryland. And I bring that to you now because I'm going to ask for permission to go to Baltimore in September. It's kind of significant because it sounds like Crossroads Clubhouse is going to be asked to be part of the presenting panel at the World Seminar, and that is a huge, huge compliment to our clubhouse. So I'm very, very proud of that. I don't know exactly what the topic will be. I'm very proud of the fact that we're quite diverse in doing a lot of things quite well at Crossroads Clubhouse. So I think that we could speak well on a number of topics. I want to say thank you to Tracy Smith for working with Crossroads Clubhouse on transitional employment. Transitional employment allows Clubhouse members to work gainful employment in the community for 9 months. At the end of the 9 months, those people that are working, they transition out, and we transition more Clubhouse members back into those positions. I think that it's kind of a challenge to really understand transitional employment because the Clubhouse actually has management and control over those positions. And when people time out with transitional employment, that doesn't mean that they're not eligible for additional transitional employment positions. That's not what we designed. That's Clubhouse International standards, that anybody that's interested in working has an opportunity to do so, and it doesn't really matter how successful they were in previous transitional employment positions. If they're interested and if they're a good candidate, then those are the individuals that we pick for those transitional employments. Crossroads Clubhouse, by the end of August, will have 40% of our average daily attendance participating gainfully in transitional employment. The Clubhouse standard is 20%, so we're doubling that. And it makes it quite That makes it a lot of work for the unit leaders because we're the ones that are going out and doing all the training. We're doing all the problem solving with those individuals that are working transitional employment. But to hear the stories of what it means to them to have a regular paycheck, coming in above and beyond their Social Security is quite impactful. And then lastly, just a reminder that the Walk a Mile is coming up. That's in September. That's September 15th. I want to say thank you to Dave for, you gave me, no, Dave and Richard, actually, because you gave me a complete blank check, right? So I can spend as much as I want. No, I'm kidding. I provided them with a budget of what it would cost for us to go. That is not a Crossroads Clubhouse event. That is anybody in Macomb County CMH event. So we've had some reminders asking people to save the date for that event. We'll take 60 people. They'll get a t-shirt. Hopefully they'll have an opportunity to meet with their state representative, talk about CMH services. There'll be a lunch that is provided, and then we also rally on the steps of the Capitol. So it's a really, really cool event, and I would love it if some of you came along for the ride. Thank you.
Thanks, Bruce. Anyone else from the public wishing to speak? Anyone else? All right, we'll close hearing of the public, and I'll take a motion to adjourn. Motion from Nick, support from Megan. All in favor? Aye, we are adjourned. Thanks, everybody. Have a good night.